on Windy City Live.
Can be complicated. So here to help us understand good bacteria versus bad bacteria in the body is our favorite OBGYN and associate professor at Northwestern University, Dr. Lauren Streicher. Good morning. I think one of the things that we want to kind of make real clear, we know there's good and there's bad, and the body needs both to operate.
Absolutely. Everyone has this idea that bacteria means infection, and it can, but bacteria also means health. We have to have a healthy balance.
I just don't even want to think about it. I don't want to look down there. I just want everything to work.
Well, you're not going to see any bacteria if you look down there. They're very little. But you're absolutely right. You want everything to work, and that's why when it's not working, women get very aware that something is off. And I think especially, okay, let's just say this is after dark. We're talking about the vagina here.
Yeah.
You know, we're not just talking about the body. We're talking about the vagina.
I was getting ready to go there. And we're talking about yeast infections, too.
And bacterial infections and other infections. And when things just aren't right. And it's the kind of thing women aren't aware that something is wrong until it's wrong. And when it's wrong, it's usually because there is an imbalance between the good bacteria and the bad bacteria.
Okay, so break it down then. Yeast infection, wrong. What, right?
Yeah, basically what the other interesting thing is most times when women think they have a yeast infection, they don't. They have a bacterial vaginosis.
Okay, what's the difference between the two?
And the difference is that normally there's good bacteria in the vagina, the lactobacilli. We call those our knight in shining armor. They come in, they keep everything in balance, no odor, no discharge, no irritation. Sure. But if something tips the balance so that the lactobacilli cannot do their thing, then the bad guys move in, Gardnerella. And Gardnerella is what causes bacterial vaginosis, which is when women get that funky odor and the irritation and the discharge, as opposed to a yeast infection, which is also an imbalance, but then women get that cottage cheesy discharge and the itchy and all that. So they're two very different things, but most women, as soon as something's off, they think yeast, and they run to the drugstore and they spend a lot of money on a product, which might help, but it might not.
Now, you just said something tips the balance because the good guys are all there working, right? Then the bad guys come in. What makes those bad guys come in?
I will tell you what it is there's an alteration in pH. And we always hear about pH. I mean, you're supposed to have pH-balanced shampoo and pH-balanced skin products, but you need to keep the pH balanced in the vagina as well. And pH basically means how acidic or basic is something. Okay. And we know that there's a nice, normal pH in the vagina. And if something tips it into the
what is that something,
pH,
though?
Well, we're gonna get to that.
Oh, okay.
Because first, before we talk, I thought it'd be kind of fun to look at the pH of various products that we're very familiar with, just to get a better sense of what pH is and how much they can differ. So this is called pH paper, and I actually use this in my office a lot to test vaginal pH, but you can use it to test anything.
Oh, I use that to test the pool water.
That's right, exactly. Yeah. And basically it's going to turn a color depending on the pH. So let's start with water, because water actually is neutral. It's not acidic or basic. It has a nice pH of 7.0, so you can see this little square there is turning a little bit dark, which correlates with a pH of 7. So that's where, in general, nothing's too acidic, nothing too basic. That's neutral.
Now, which one of these squares are you looking at?
We're looking at the second square right now that just turned green. Yellow is acidic, and green, the darker it is, the more basic it is. Okay. So then we get to soy milk. Soy milk, again, we're looking, it's turning dark, so we know that this is a little bit on the basic side, so that we have a pH here of 6, a little less than water, but still
because you said normally our pH for a woman needs to be a 7.
Water. Well, no, water is 7. Water is 7, depending on the part of the body. And then we get to egg whites, which is kind of interesting. Egg whites turns navy blue, and this is because the pH of egg whites is close to 8, so really, really dark. And then we get to beer.
I guess what I want to know, Dr. Streicher, is are these good numbers or bad numbers?
These are good for beer, good for egg whites, good for soy milk.
Everything.
But what we want to know is, and this is a pH of 4.5.
That's not good.
Which for beer, it's perfect. Which of these products do you think is closest to the pH in the vagina?
Oh boy,
for a healthy vagina.
Oh my goodness.
Water?
Water.
Beer.
Oh.
Beer. And in fact, I asked Ryan before the segment, what do beer and a vagina have in common? And he gave me the right answer. He said they both make men have bad judgment. So the point is we need to keep the pH of the vagina at 4.5, 3.5 to 4.5 for that healthy balance. So no, you are not going to put beer in your vagina.
I was going to say, does drinking a lot of beer help with that?
No, it does not.
Oh.
But, you know, obviously we don't put any of these things in our vagina, but what does go in a vagina that can tip the balance, that can cause that 3.5, 4.5 to be off?
Okay.
Well, number one, sperm. Let's blame the guys.
Okay.
Sperm has a pH of close to 8 sometimes, and that's why a lot of women, after they have sex, they kind of have that funky smell. It's not because the guy smells bad, it's because it has tipped the balance. Blood. A lot of women, after they get their period, blood has a pH of 7.4. So a lot of women say, every time I get my period, I get a little odor, a little discharge, things are a little bit off. So there are things that can tip the balance. So of course, what we want is to keep the pH of the vagina normal.
And how do you do that?
Well, it's not by taking lots of showers. And I think that's an important point, that a lot of women think if they have an odor that it's because they're not clean, that they haven't paid attention to their hygiene. This has nothing to do with hygiene. So women feel so guilty, like, oh, I got to take more showers.
What about eating a lot of yogurt?
You know, eat a lot of yogurt if you like it, but it goes right through the gastrointestinal tract. It does not go to the vagina. And yes, there are some women that put yogurt in their vagina because yogurt does have lactobacilli, but it's really not the way to go. So we don't recommend
whirlpools? Will being in a whirlpool or bathtub increase your pH?
No, actually, because the water doesn't really get in the vagina. Douching can create problems because if you're putting water up there, and then sometimes it'll have additives in it. So we don't recommend douching at all because it dries the tissue out, it throws off the pH. Now what you can do, there's actually a product out that is to restore normal pH if someone has tipped that balance, and that product is called Refresh, and I have some here to show you. And what Refresh is it's, you know, re-pH is really what it's about, Refresh. And for a woman who finds that maybe after her period or after she has intercourse, if things are a little bit off, it's a gel, she puts it in her vagina, and for a lot of women that will stabilize it.
So but this is what brings everything back to normal.
This will bring it back to normal. Now sometimes we actually have an infection and we need to give antibiotics to get it back to normal, but if there's not a big infection, it's just a little bit off, this will do it. But more important is we want to prevent it from happening in the first place. And I think everyone is familiar with probiotics that we use for colon health. Well, there's actually a probiotic for vaginal health.
Oh, really?
Yeah, and it's made by the same company, and this is called Pro-B, and this is a capsule, and basically this is to balance yeast and bacteria, and you take this capsule every single day, and it does balance the yeast and bacteria vaginally, which will prevent, in many cases, women from getting yeast infections.
And you don't make any money from Refresh, do you?
I wish. Oh boy, I wish.
I just gotta ask.
No, I don't. But it is a product that I recommend for my patients because it really does make a difference.
All right.
So yeah,
I think we got all up to speed about good and bad bacteria. Thank you so much for watching, Dr. Streicher. Thank you. We will see you tomorrow morning at 11 a.m.